YouTube channel. I am Ariba and I am a medical student studying in New Vision University, Tbilisi, Georgia. Currently, I have started volunteering in the New Vision Hospital, and so I thought why not to make a video and to share you my experience of first day in hospital as a medical student or my first week in the hospital. So here I am with this video, and in this video I'm going to be sharing about how I applied for the volunteering procedure, and how is my experience and how it's going in the hospital. And at the end of the video I would share you some tips, do's and don'ts if you are going to have your first day soon nearby. So I hope you enjoy this video. So how I applied for the volunteering session. After finishing my fourth semester, I decided not to go back to my country. So I stayed here, and in my vacation I got an email from the university which asked for joining the volunteering session, and so I just filled that form. And just 2 days before my first shift in the hospital, I got this email which mentioned all the details, and it said that you would mandatorily need your scrub clothing, scrub caps and shoes, and also it mentioned that you would be in close proximity with the COVID-19 patients, so it's at your own risk if you want to join in. So I thought why not to give it a chance and get into the clinical exposure. So I just joined in. So now directly into the story. My first shift was from 3:30 p.m. till 10 p.m. So I just decided to go 30 minutes earlier at the hospital, and we were asked to be at the first floor. So I went there, and when I reached I saw literally no one, and I was really nervous inside, and I saw there no one, and I stayed there for 10-15 minutes, and then two seniors, they came, and they were from the 10th semester. We had a casual conversation, and they said me that it was their first volunteering session as well. They didn't had any clinical exposure in the hospital before, and so it was their first time, and they were nervous too. And we just had the conversation, and we were waiting for a lady who was in charge of guiding us what to do next. So we waited there more 15 minutes, and then there came one lady whose name was, I guess, Katie or something, and she came and she asked us to get into our scrub clothing. And after then we were asked to go on the 6th floor of the hospital. So we went to the 6th floor. There we were asked to wear that PPE and don the gloves and like everything. And after that she took our presentee who were present. There were about 15 students on that shift that day. So we just then went into that 6th floor section. There it was a COVID ICU ward, and as soon as we entered, there were many rooms, but she took us into a particular room. And as I entered, I could hear the beeping sound of the like vital monitor machine, and I was like, kind of it felt really different. I was just keenly observing everything. There were different patients, approximately 8 beds in that room, and I was just observing. There were nurses and doctors and residents. So for first 10 minutes I was just figuring out what's going on here, because it was really different. And since we were all standing there, and everyone was nervous and scared that what we are supposed to do, and we were just standing there, and then I saw a senior doctor entering the room, and he was going towards each patient. Maybe he was on the round, and so I decided to talk to him, and I asked him that what happened to this patient. He was standing nearby, and he said that this patient has a COVID, and he described me the details of the patient, and he asked me to see the oxygen saturation and stuff. And so I said, he asked my name, and he said that what specialization you are going to go in, and I said maybe I would see in surgery or something. And he was so kind and so generous and very frank, literally. And I said him that I have just completed my fourth semester and I'm very new. I don't know anything now. And he said, okay, no problem, don't worry, you will understand it. And then he went towards each patient, and he was describing our group the condition, like what was with each patient, because all of them had COVID, but along with the being COVID patient, they had other conditions as well. So he was describing us. We went to a patient, and she had severe erythema, which is a skin rash due to inflamed blood vessels. And he described us the situation of that patient. And after then he just went into another room, and then I asked him that could I accompany you, because he was on the round. So I asked him that could I accompany you to different patients, and he said okay, and he agreed. So we went into different room. There were different patients, and while he was going towards each patient, he would say, Raghur Khar, how are you? Skali Ginda, do you need water? So there was one lady who said, yes, I need water. And the doctor asked me to bring him water in injection. And so I was like, I didn't know how to do that. So I was just wondering, and luckily there was one lady who, like nurse, who helped me how to do that. And I said her, okay, I'll remember this. So that was the first thing I got to do. I know this is like really very basic thing, but that was the first thing I got to do. And then he taught me how to feed the patient, taking out the oxygen mask through injection. And so yeah, after that we went to different patients. And again he was describing me conditions. We were comparing different patients and their saturation levels and stuff. After that we went to another room. There were like 4 patients in that room, and as soon as we entered, I said Gamma Juba to 2 patients there. They were facing towards me, so I said just Gamma Juba. And one of them, he was doing respiratory exercise with that spirometer. And other he was sitting there, so they were in better conditions, I guess so. And better than others I would say. After that we went to another patient, and he seemed to be in pretty serious condition. And so doctor was just checking, and he had so many what would I say, hematoma. Like I could see over his hands the marks, and the pressure ulcers were there. And like his condition was not that good, and his oxygen saturation was very low. And doctor just ordered a nurse to like ask the another doctor to take his x-ray. And like he become a little tense that time. And he asked the nurses to take his blood samples. And then he was like, I think you should now go join some other doctors. And in that moment I understand that something's not good with this patient. And so I said okay, no problem. And then I went to another room. And so then I went to another room. There I met Dr. Kengo, and under his supervision I got to learn many things. He's really a good teacher. I introduced myself to him and I said that I'm here for volunteering, and I said him that I don't know absolutely nothing, and he said okay. I said him that I have done though my clinical skills one, and I have done many things over the cadaver, over the dummy, not the cadaver, sorry, over the dummy, and not on person ever. And he said okay, I'll teach you. And then the first thing he asked me to do was he asked me to administer some medicine into hand catheter of a lady patient, and I was a little bit nervous, haven't done it ever before. And he said don't worry, do it. And so that was the first thing under him that I did. And after that he taught me how to administer certain drugs through the natrium, like the NaCl solution. Then he taught me how to place the ECG cord over the patient, and so we did changing of the patient, position of the patient, changing bed sheet, changing clothing, and also we changed, like he taught me how to do fixation of the nasogastric tube, which I had done in my clinical skills one, and feeding with the NG tube. So that was what I did, and then he asked me to take 2 bottles of adrenaline and then to mix it with 40% solution, and then he taught me how to give it through infusion pump. And so that was really interesting, like to do that. So and then after that, like I did many stuffs, like mixing the medicines. He asked me to take an injection and mix it, so that was the thing. Then there came a nurse whose name was Tamar, and she was really so kind, and we conversed for some time, and I told her all the Georgian words that I knew, and she said, oh wow, like I would teach you. I said her that I'm a student, so she said that okay, I'll teach you from the very basics. And it was under her that I got to learn so many things, like she was so helpful. So then we went to another room, and she taught me how to administer again some medicines through the saline, but this time she added some information that certain medicines could not be directly added, so you need to check it. And then she taught me how to check the patient's medications, the list of the medications, like which drugs are administered, and how to know that by which sign we indicate that it's over or it's in continuation, or you have done this procedure over the patient. So with the chart, she taught me how to read that patient's chart, and then she taught me how to empty the urination bag of the patient. And yeah, we marked the readings, and it was really nice with her. And also her father was admitted in the same room, and also he was having COVID, so she was even like being on duty, but still she was caring for her father as well. So we did again, she taught me how to do feeding by the NG tube, and how to feel it's already inside the stomach, so we need to check it over the stomach, and you feel like a different sensation that it's reached there. So that was it. And yeah, before going, like it was 9:30 or so, and then it was 9:30 or so in the like at night time, and then Dr. Kengo told me that they are going to do CPR on again one patient. And so if I want to see the like I can join. So I was there, I was just standing in the side, and there was a tense moment again, and it was like they were trying different doctors, they were trying to bring her back. But they couldn't. And even before that, some procedures were done, like taking the x-ray of the patient and stuff. So I really feel bad for that patient, and I was like, okay, this is like part and parcel of life, and you need to be strong. So that was how was my first day. And after then I just like it was 10:30 already, 10:15 or 10:30, and then I left the hospital. And when I was going, I was just I took some selfies and some photos and to just remind me of the first day. It was really wonderful, and it's really wonderful feeling. It was different from what I expected. Nothing like what usually we are asked to do on our first day, like writing a history of the patient or stuff. It was totally different stuff. And so as I was going, I was like feeling really gratitude towards the universe and the power that I'm able to be in this profession. And so I was really happy. By the time I was going back, I was just recalling what I learned today. It was so overwhelming feeling, I can say that. And then 3 days after my first shift, I again had the second shift, and this time it was in the morning. Yes, correctly. And we got to do, like, I would just say out the main things that I did, because I did many similar procedure and many more stuffs. So I got to see an invasive procedure, that is CVC of the patient. CVC is central vein catheterization, in which a small tube is inserted in the like the main vein of the patient, and it is done for giving the drugs or some kind of medicines to the patient. So it's basically done in the jugular vein or maybe subclavian vein, or sometimes it's even done in the femoral vein, which is near the thigh. So in this time we were doing it on the, like, the doctor was doing it on the central vein catheterization was in the subclavian vein, which is near collarbone in the chest region. So there was one nurse, and she's one a medical student in our college, and she just said me, we are going to perform this, and she showed us all the equipments that are going to be used. And so we were keenly observing. There were 3 of us, and this time so we were waiting for the doctor to come, and it was on an old patient. And like they gave her anesthesia, and then they performed the procedure. And we were just wondering, because I literally have seen only it on the dummy, and it's really different experience. What we read and what we perform on the dummy is totally different from what is performed in the hospital. And in that situation it's different, like you need to act quick and to the situation. So we saw that procedures, and we asked questions whatever we had to the doctor, not in between, but like after completing the procedure. And so everything he was doing, he was just describing us what he is doing, which vein he is going through, and how he is doing. So it was an old we were just near it. It was really like a movie scene, I would say. So that again there was some another things that I got to learn. was checking the central vein pressure, like central venous pressure, which is normally 7.5 to 12 Hg normal. So we learned how to check it. That day I literally felt that we were at right place on the right time, because there were so many students, but whichever doctor I was going under, like I was going towards, and they were performing the major procedures, so I got to learn many things. So learned how to perform central venous, how to check CVP. So done using that capillary refill method, and if it's below the normal range, which I said, then the patient is hypovolumic. It's above the range, then it's hypovolumic, and if it's hypovolumic, it might be risk for the heart. And that was the thing. And again, about the nurse Tama, she taught us about the different medications, like how they are placed in the cupboard. And so she gave us, I didn't have had yet pharmacology, so I really know little about the medications used. So but still she was teaching us so well, and she taught us how these are placed, how the toxic medications are placed upward, and how to place the medicines, and what are the drugs you need to use. And also I learned few Georgian words that doctors use, because they don't speak English, they speak in Georgian. So it was like cotton is said, bamba, and injection or needle is said nemse, and the system is said systema. And there were like many different things. The ECG cord is said kapochka or something, like for each and everything it is totally different. So yes, after that we clicked some photos, because it was afternoon time and all the major procedures and the checkups on the patients were done. So we were clicking photos that day. And and then it was 4 p.m. and then we left. And then on the third shift, which was again 2 or 3 days later that, so in that the major thing I got to see was a lady patient with severe emphysema. So emphysema is a condition in which the lungs of the patient gets filled with air, and I could like literally observe her whole chest region was filled with air. I could feel it by touching, so yes, a different thing in the same exact patient was the sound of crackles. Like a doctor said me that she is really an interesting patient for you students. So I heard the sound of crackles in her lungs. That was different. And again we saw about the x-ray. Yes, they like another doctor, she took x-ray of different patients, and we saw that. And a unique condition again what I saw was a patient with chicken chest. Yes, there was a lady patient, she had chicken chest, and this is a dermatological condition in which the ribs, they are like it's in different position. I don't know exactly, and it is hereditary generally. So that was a different thing again. That day we did all the stuffs like again, but it was with more confidence this time, giving injections through the catheter to the patient, and changing the saline of the patient, like the dripping of the patient, and injection. Yes, this day we were asked to even give the injections to patient. And since we didn't had pharmacology, but there were other elder students, they might know what is for what, but since I didn't know, so I was just doing whatever the senior doctor would ask me to do. And I would even try to recall the drugs, name of certain medicines. And yeah, then I came to learn about certain patients. They don't want to eat the food physically, nor they want the nasogastric tube. So there is another way in which you can give like the food through infusion. So there was some Baxter medicine in which it is given in certain intravenously, and I don't know very much details about that, but that was interesting thing for me. So I saw that. And again this day I was asked to check the glucose levels of many patients. And yeah, we got how to mix certain drugs. And yeah, there are two drugs and you need to mix them. One is in powdered form and another, like it's different. And that was how it went. And each week I'm learning new things, and I'm seeing the progression of different patients. Some are getting better, some are getting worse in condition. And it's sometimes sad when you go and they recognize you and you ask like about, there are certain patients who have been shifted, and you ask where is that patient, and they say they are no more. And because staying even morning till evening, that builds a kind of connectivity with the patient. So I had hard time for that. So, and yeah, each day I can say that reading from the books is very different than practicing it in clinical, like in hospital. So you got to learn many things. And so what I learned was each day, with each passing day, I was getting to learn more and more things. And on my fourth shift, which was again in the evening, from 3 p.m. till 10 p.m., that day was really crazy day. In that day we saw a patient and he didn't wanted anything to be administered to him, no injection, nothing. We needed nurses to hold his hand, and so he was moving. So there were two nurses holding him and one doctor, but he was moving. So like there was certain injury to his hand. And so they called emergency emergency medical team there, and they took it to different department. And it was really, the situation was different because you got to see this whole things it happening there. And so he was immediately shifted to in the emergency department. And again there was some another patient, and seeing this man, even he was behaving like him, that I don't want now it anymore, like I'm fine, I can go home. And even he removed all his catheter and stuffs, and he was walking. And so doctors were running behind him that stop and don't go, and explaining him and making him understand that how important it is to stay, and that you'll get better and stuff. So that was a dramatic day, that my fourth shift, that was really filled with so many drama. Then there were some lady patients who were also fed up with being in the hospital and being bedridden. And so they were like, now we want to go home, call our family. That was a dramatic day, I would call it. And again on my fifth shift, same kind of things. And again I came to knew on my fifth shift that the lady with the emphysema, she didn't make it up. And I would see how senior doctor, like his name is Dr. Giga, so how he motivated patient. And so over my fifth day shift, there was one lady patient and I was asked to feed her, so I was just being besides her, and I just gave her a gentle touch over her forehead to feel loved. And because these patients, they are not able to contact their family, it's just over the little phone they have, no video call, because these are all elderly patients and they don't know how to use this stuff. So I was just, even though I didn't understand what she was saying, I was like just being there. And after doing whatever I was asked, so I was just leaving. And then there was one doctor, his name was, I guess he is a student, not doctor, but he works there. So his name was Gurami, yeah. So that lady patient, she was really old, maybe in her 80s or so, or 75, I don't know. So she asked him to ask me to stay there, and he said that she don't know English, she doesn't speak English. And she said, but still I want her. And in that moment I really felt so nice inside, that sometimes all a patient need is just a kind touch or gesture. And even if you cannot speak with the patient being in another country, or if you are having practicing in Russia or any other country where English is not that spoken and understood by the elder patients, so all you could do is just a kind gesture of motivating them or trying to understand what they are trying to say, just saying them like this, okay, you are strong, you'll do it. So these are the things that make difference. So yeah, again the same things were asked and done. So that was how was my entire 3 weeks, I guess, 3 or more than 3 weeks. Okay, it was 3 weeks. So this was how. And what I did in the whole weeks, I had my shifts on. So I hope you liked it. And so that was all about it, my experience in a hospital as a medical student. There are certain do's and don'ts and tips that I have written down for you. And if you are soon going to have your first day in school, so what are the things that you need to keep in mind and consider? So first thing I would say is, as soon as you go there, just observe even the minute details, like everything you need to observe. And compare stuffs, like compare the readings and different patients, how are things different for them. And also by even observing, there are many things you would learn. And the second thing is, be curious. Yes, like when you're curious, you learn more. So be curious. And don't hide something. If you don't know anything, just say right away to your senior doctors or whoever are your subordinate, like above you. So say them that I don't know this, just straight away, there's nothing to shine. And another thing is, ask question. It is said that somebody who asks a question is fool for a few minutes, and one who doesn't ask is fool forever. So don't afraid of asking question. If you don't know something, ask it right away. And yeah, use common sense, because there are like, use your common sense and be active. And the thing is, just I would say, keep a diary handy with your pen in your scrub pocket. That is what I did. And note down whenever you learn new thing, so note it down right away, right there. And whenever you have free time, or when there's nothing to do much for you, go and search on net or Google it, whatever the new information is, and store it. And maybe if you want, you can discuss it with your other fellow friends. Yes. And grab every opportunity to assist. Yes, like nobody would say you come help me, you have to do it by yourself. So keep your eyes open, and whenever somebody needs your help, even the smallest job, do it. And yes, don't feel shy for doing the small jobs or things that, like, you thought these are not for medical students, so don't feel shy for that, because it's from the basic stuffs you learn it. You cannot build the entire wall directly, you lay it brick by brick, right? Same in the similar way, it's just you cannot learn the procedure directly, you need to start by basics. So by doing basics, you gain more confidence, and even the doctors, they would allow you to do more stuffs. And yeah, when there's an invasive procedure going on, don't ask question in midway, just keep the questions in mind, or maybe note it down if you have the opportunity to. And when the procedure is over, because there are so many patients for the main doctor, so there are nurses or there are resident doctors, ask them when the procedure is over that why certain things are done, and why this and why not this. So don't ask in between. And yeah, these are the things. Yes, and the thing, one more thing is, maintain, like, help patient maintain their privacy. They are not used to being open in front of anybody, so just keep that in mind. So yeah, and sometimes all a patient need is a little touch, or maybe just a genuine care, or maybe just that you are listening, you are there. So just do that for them. And because not in the COVID situation, their family cannot visit them often, so it's only you, they are just seeing you there. So just show and do it with care. And what else? And when you are leaving the hospital, so just thank each and every doctor who help you learn something. These are the basic etiquettes, but this make difference. Yes, respect everybody, the nurses, the workers who are for cleaning, everybody. It's how you treat others define you, so treat them well. And just, I would say, don't make comments over the patients. Yes, because see, the patients there are for maybe some time, but the impact you leave on them would be forever. They'll remember you. If you don't understand their language, just give them gesture, try to motivate them. So this was all about my experience as a medical student in hospital. I hope you enjoyed this video, and if you did, please like my video and subscribe to my channel and support me for more such videos, and I'll try to make more videos and keep you updated. And yeah, that was it. So thank you guys for watching the entire video, and sorry for a little unsteadiness in the camera for certain period in between. Thank you so much, and have a great day. God.